Hello, welcome back to my channel, Psych DNP student. I'm Nurse Jackson. Today I would like to talk to you about the difference between working night shift versus working day shift at a psychiatric hospital. I've worked both night shift, day shift, and I've also worked evening shift. And from my experience, I found night shift to be easier. Now, the reason why I found night shift to be easier is, for the most part, the patients were asleep. You might have a patient or two who couldn't sleep, but they generally came and asked for something for sleep. And if there was something already prescribed, then you would just administer the medication as ordered. If not, you would call the psychiatrist or the medical doctor, and you'd ask, let the doctor know the patient could sleep, and then he would prescribe something for the patient. Or you may have a patient who has, who is experiencing pain. They may come up and ask for pain meds. You give them the pain medication as indicated. Other than that, night shift was pretty quiet. Now, once I was done making rounds and checking out my patients, I would go to the medication room and I would check the medication refrigerator temperature and document that temperature. Generally, in the medication refrigerator, we keep Ativan IM, we keep insulin, we keep Risperdal Consta, PPD solution, and any other medication that needed to be refrigerated. Now, in the medication juice refrigerator, we usually have we had the Glytrol, Glucerna, Boost, Isosource, medication juice. We had pudding, applesauce, and any other food or juice that was needed for the patient for medication pass. So that temperature would have to be recorded as well. In addition to that, I had to record the temperature, the physical temperature of the medication room. Once I was done with that, I would go back to the nurse's station, and at that time, I would work on my monthlies, I would work on my weeklies, and I would check the patients, do my rounds, and check on the patients. So sometimes you might have a one-to-one. And if you had a one-to-one for self-injurious behavior, or one-to-one for suicidal ideation, or one-to-one or for excess fluid consumption, which is probably dyspsia, whatever the one-to-one was, you document on that patient. The key with the working night shift is you have to make sure you do thorough documentation, because what has happened in the past, years ago when I worked, there were a couple of different times where patients actually died on a different unit throughout night shift. So of course you want to do thorough documentation, and you want to watch your patients very carefully at night. Again, at nighttime it's usually pretty quiet, so you can get a lot of work done. Versus when you work day shift, in the morning it tends to be very hectic. When you arrive to the unit, you have to do rounds, you get report from the night shift nurse, and then you count your narcotics to make sure that the narcotic count is correct. Once that nurse leaves, you get ready for your med pass, you do your assignment, then you have your treatment team meetings. You may have to prepare some packets if they haven't been prepared for patients to go out on detail or other medical facilities. And you have patients who are attending groups. You may have to run a group. So there's so many different things that are happening throughout day shift, in addition to having team members come into the unit, taking charts, documenting on those charts, and returning the charts. It's very hectic during the day. It's very busy. But again, it varies depending on the unit you're working on. You could be on a geriatric unit. You could be on a DDD unit. You could be on a deaf unit. It just all depends on what the need is at the hospital. That's pretty much it, guys. I just wanted to kind of do a comparison of what my experience was like working night shift versus working day shift at a psychiatric hospital. Thank you so much for watching, and remember to subscribe to my channel. Take care. Bye-bye.